Let's move on to our final presenter this morning. Our next presenter is Viet Nguyen. She received her Doctor of Pharmacy and Master's in Business Administration at Oregon State University in 2006. That's a big thing to pull off, those two together, and has dedicated much of her career here at CareOregon. Viet has been working in Medicare Part D formulary and benefits administration since 2010. So get ready for the deep dive of authoritative info, friends. And this will wrap us up for our program today. And then, whatever time remaining, we'll handle some of these questions that have been coming in on the Q&A. So thanks so much for your patience. And we will go ahead and get started. Please welcome Viet.
Thanks, Paul, for the introduction. I'm excited to be here for my first Meds Ed as a presenter and also part of the audience. And then I'm also happy to be presenting about Medicare drug coverage because it's very heavily nuanced and also very different than how we manage our Medicaid formulary and criteria. First, I just wanted to provide a quick background of Medicare coverage. At CareOregon, we manage our formulary and criteria very differently than how we do it for Medicaid, and that's because we're really highly regulated by CMS. So Medicare is covered for people 65 and older, younger people with disabilities, and then people with end-stage renal disease that are undergoing dialysis or have had a kidney transplant. So what is extremely confusing is that there are different parts of Medicare. There's A, B, C, D, and that there is drug coverage under each of these parts, which can make Medicare extremely hard for beneficiaries to navigate. There is Medicare Part A, which is the hospital insurance part of Medicare. Drugs that are provided here are provided during a patient's inpatient stay if they're receiving drugs and they're in a skilled nursing facility, or if they've elected hospice and they're using a drug for pain or symptom relief related to their terminal illness. Part B is medical insurance. Part B covers drugs that are not normally self-administered and given in the doctor's office or an outpatient infusion center. There is limited drug coverage in the home, but those have been set by CMS under statute. For example, drugs used in a durable medical equipment like a nebulized albuterol in a nebulizer. And then CMS will also cover oral chemotherapy if there's an IV equivalent. Just to provide a few examples of some limited drug coverage in the home under Part B. At CareOregon, we don't maintain a Part B formulary. We pretty much cover everything that original Medicare would cover, but it may require PA just to make sure that it's not being used for a non-covered use. And then it also may require step therapy for people who are newly started on the drug to ensure that people are using lower cost alternatives. There is some limited rules that CMS puts out in national coverage determinations and local coverage determinations, and we'll always review those first before we look to the drug's indication to determine whether or not we can cover that drug. Part C is a private plan known as Medicare Advantage that covers both Part A and Part B. Part C plans, they contract with the CMS to provide those services to beneficiaries. And then all other drug coverage may be covered under Part D. Beneficiaries can get Part D in two ways. They can enroll into a prescription drug plan or known as a PDP, or they can also enroll into an MA plan that offers prescription drugs or an MAPD, like CareOregon Advantages. Each plan manage their own formulary and PA and step therapy, and so as beneficiaries navigate different coverage options, they it's important for them to look at each of those plans formularies to make sure that their drug is covered and at what cost. And if that wasn't at all confusing, the same drug can be covered by Part B or Part D in certain situations, and CMS requires plans like us to ensure that we're covering that drug correctly under the different parts of Medicare. For example, nebulized drugs like albuterol is covered under Part B if the person is using it in the home, but then it's covered by Part D as in dog if they're using it in a long-term care facility. At CareOregon Advantage, and I think with many other MA plans, how we manage that is we look for the patient's residence code when the pharmacy is submitting that claim to determine whether or not they're living in the home or if they're living elsewhere to pay for that drug correctly. And then CMS also requires us to prospectively review claims for members who have elected hospice or they have end-stage renal disease, because CMS does provide a bundled payment to the hospice center and then the ESRD dialysis center for coverage for those members. And so we're ensuring that those drugs are covered by Part D appropriately, or if not, if it should be relayed back to the hospice or the dialysis center, that we provide that information back to that member that they need to go back to those providers to get their drug coverage. And then also, we also do a retrospective review to make sure that the coverage is appropriate also. CMS requires that we follow certain rules when it comes to formulary placement. At least 2 drugs in each drug category or class must be covered. They have to be chemically distinct unless that drug category class only has 1 available drug. For CareOregon Advantage, we cover more than 2 drugs in each category class for the vast majority of medical conditions. In addition, we also cover dosage forms like solutions and infusion injections of those drugs that are commonly used in long-term care and for home infusion. Commonly known as protected drugs, substantially all drugs in the 6 classes of clinical concern must be added to the formulary. So these are drugs to treat HIV, AIDS, depression, antipsychotics, seizures, immunosuppressants for transplant rejection, and anti-cancer drugs. There is an expedited review process that's required by CMS, and after 90 days on the market, CMS requires that the drug be present on our formulary. And then we can put PA or step therapy on those drugs, except for HIV and AIDS. The manufacturers have been really successful at lobbying CMS to not require PA or step therapy on those drugs. So what that means is that PA and step therapy can be used limitedly in the protected drugs. We can't require a member to use a different alternative if they're already taking the drug. MAPDs will also cover all commercially available vaccines unless they're covered by Part B. So Part B vaccines are your flu, your pneumococcal, and your COVID vaccine. You may have heard of the Inflation Reduction Act. So all vaccines will be $0, including the Part D as in dog vaccines in 2023. You may also see that plans have PA for drugs that may be common or inexpensive, and that's because plans are required by CMS to review drugs that have a high likelihood of being used for non-Part D use. So that could be excluded or it can be covered by Part A or Part B. We go through a very rigorous review with CMS every month and then also annually of our formulary and our PA and step therapy. The formulary and the criteria gets posted every month. And then if there are any concerns by CMS, that needs to be addressed with CMS every month, or they will suppress our formulary from the Medicare Plan Finder tool that beneficiaries use to compare different plans. Drugs must meet the definition of a Part D drug before a Part D plan can cover that drug. The drug must be dispensed upon a prescription and can include biologics, insulin, and their supplies and vaccines that are dispensed upon a prescription. They also have to be used for a medically accepted indication as defined by the Social Security Act. And these indications are either approved by the FDA or supported by CMS approved compendia. And the two compendia are Micromedics Drug Dex or AHFS. And if it's cancer related, CMS also requires us to review cancer guidelines, and also it expands the review to well-studied randomized controlled trials. And it also needs to be used to diagnose or treat an illness or improve the functioning of a malformed body member. So things that work on a mechanical device like heparin flush around an infusion line, those things are not covered by Part D. And then compounds at CareOregon Advantage requires PA for all prescriptions, and at least one Part D ingredient needs to be in that compound before we will cover it. So a compound that is made with all powders will not be covered. And Cory mentioned Toby nebulizers used in the foot bath, and so CMS, you may have heard that Medicare beneficiaries are being targeted by these schemes. And so the foot baths are one of them. And so that's the reason why we PA a lot of these drugs, is that to make sure that members aren't getting inappropriate care. And then most drugs used for home infusion are covered under Part D. Under Medicaid, these drugs are covered under the medical benefit. However, as you may remember, that Part B has very limited drug coverage in the home, and so that's the reason why most drugs used in the home, even if it's through an infusion line or through an IV push, that's covered through the Part D benefit. So members have to get it through their pharmacy benefit. There are a number of things that Part D plans will not cover. Here's the list of them. So over-the-counter drugs are not covered by Part D plans. The drug has to be approved by the FDA, and the NDC has to be listed with the FDA. Applicable drugs, so these are your brand drugs or your biologics that have a very specific designation with the FDA. Those manufacturers that don't participate in the coverage gap discount program, those are not covered by Part D. Drugs to treat anorexia, weight loss, and weight gain, those are excluded by Part D, even if it's used to treat morbid obesity. A covered use for weight loss, or well, not weight loss, but weight gain, is if they're using a drug like dronabinol for AIDS wasting or cachexia. Drugs used for fertility is not covered by Part D. Cosmetic or hair growth is excluded. Psoriasis, acne, rosacea, vitiligo are not considered cosmetic and can be covered by a Part D plan. Drugs to be used for erectile dysfunction, those are excluded by Part D. Cough and cold medications are excluded by Part D, and then prescription vitamins and minerals, except for prenatal vitamins and fluoride. For prenatal vitamins, CareOregon Advantage covers it only for childbearing women, and very limited prescription drugs on the Part D benefit. Most of the prenatal vitamins are over the counter, and they're covered under our Medicaid benefit if our member has Medicaid. And then, like I mentioned before, drugs that should be covered by Part A or Part B are excluded by Part D. Now that I've gone through some nuances of what's covered by Medicare, I wanted to go through some examples. So insulin supplies, so your syringes, your alcohol swabs, those are all covered by the Part D benefit. We do have most generics, insulin needles and syringes on a Part D benefit, and we cover alcohol swabs also. So sildenafil, we cover that for pulmonary hypertension, but for erectile dysfunction, and even if the off-label use is supported by compendia, we do not cover that under Part D. Other plans may cover sildenafil for erectile dysfunction under an enhanced benefit. Those plans are covering that drug under their administrative costs, and so that's not accounted to CMS. And so that's really just to improve member experience. Ozempic, most of our diabetic drugs, including the GLP-1 agonists, are covered under the Medicare formulary without PA. And that's different from Medicaid in that we're doing this to improve adherence and also member experience. And we do have PA on Ozempic, and if you have a guess why, please put that in the chat. So for type 2 diabetes, we do cover Ozempic. We have coding in place to look for another diabetic drug, and if that is part of the member's claims history, then that drug, Ozempic, will pay. However, if it's for weight loss, then it's excluded by Part D, and we will not cover that, and we would actually deny that the drug for that use. Increasingly, prescribers are using Ozempic for weight loss, and that's on CMS's radar, and so CMS is requiring plans to review certain drugs like Ozempic and Victoza to make sure that plans aren't covering it for weight loss unintentionally. You might be surprised to see prednisone on this list of example just because it's very cheap. So for prednisone, it's covered by Part B if the member has a Medicare covered transplant, but for Part D, for all other uses. For the vast majority of prescriptions that a member takes to the pharmacies, they won't see a rejection. And that's because we have coding in place to look to see if that member has a transplant. And if a transplant is seen by the claims system, then the drug will be covered by Part B accordingly, and then Part D as in dog if there's no transplant found. So tyrosine, loratadine, calcium, and vitamin D, these all have a common theme in that they can be covered by Medicaid with a prescription. For most of our CareOregon Advantage members, they are dual eligible, meaning that they have Medicare with CareOregon, and then they also have Medicaid. It could be through one of the CCOs that we contract with. It could be with another CCO, or it could be through fee-for-service. For CareOregon Advantage members with our CCO, these drugs are covered by our Medicaid benefit with a prescription. And then most likely it's going to be covered by another CCO or fee-for-service, but it's safe to check to make sure that these over-the-counters and other over-the-counters will be covered by a different Medicaid plan. Lidocaine 5% patch, that is a drug that is commonly prescribed by our prescribers for a lot of pain conditions. Under Part D, we will cover it for post-herpetic nerve pain, diabetic nerve pain, cancer nerve pain, chronic back pain, and then osteoarthritis of the hip or the knee. And then for all other uses, Part D does not cover that drug. Guaifenesin for cough and cold, that's not covered by Medicare or Medicaid. And surprisingly, we do see rejections for Cetaphil lotion. And of course, it's not covered by Medicare or Medicaid either. And lastly, nutritional supplements, if it meets Medicaid criteria, then it can be covered. And if it doesn't, then it won't be covered by Medicare or Medicaid. So these examples, they all have a common theme in that there may be another option if a Medicare member has CareOregon Advantage as their Medicare plan. And that option is all of our members have an extra benefit called the Care Card. This year, it's the OTC Plus card, but in 2023, members will receive a new card, and it's being rebranded to the Care Card because it's a multi-walleted card that will house their OTC and healthy foods benefit, which is a benefit that provides members with $395 per quarter so they can spend on over-the-counter items like lidocaine 4% patch, Cetaphil lotion, cough and cold medication, and then also the nutritional supplements that I went over in the previous slides. The funds do not roll over from quarter to quarter. It's a lose it or use it or lose it benefit. They also have access to dental care, $1,500 per year for services that's not covered by Medicaid. And then our members are eligible to earn up to $405 a year in Part C and Part D benefits. And so in the table over at the bottom is a list of the healthy rewards activity that a member they're eligible to qualify for if they were to complete that activity or that health screening or the lab screening. And once we see that claim, then we will fund that reward onto the member's card so that they can spend. There's some limitations with what they can use for their Part D rewards. They can pay for most things except for firearms, cigarettes, and alcohol and gift cards. But mostly, if the OTC and healthy foods funds don't pay for that item, then their Part C and Part D rewards will take over. And we have a lot of different vendors that our members can go to and use their card. And to the right is the different vendors that accept the Care Card, including some online vendors that provide meals like Mom's Meals and Farmbox Direct. One of the advantages of being a CareOregon Advantage member is that we provide them with a lot of extra exciting benefits. And here's the list of benefits that are offered for 2023. $0 prescription drug copays for maintenance drugs and vaccines. That's actually a new thing that we've been offering for the last few years. In 2023, what's different is that we're not requiring a prescription for 84 to 90 days for maintenance drugs. And so if a member were to get a 30-day supply of lisinopril, even if they are statutorily required to pay a copay, they won't be paying a copay next year. For acute medications like opioids or antibiotics, depending on the member's low income subsidy level, CMS does subsidize our members because all of them have low income, a certain cost to pay for their prescription drugs. And then they have a very small generic copay and brand copay. And for LIC3 members, these are the members who are institutionalized. They don't have copays at all. And once they hit catastrophic, which is what they pay for prescription drugs, along with what others like CareOregon Advantage and CMS pays for that drug, all of their copays will be $0 for the rest of the year, except for members who have partial subsidy, which we don't have very many at CareOregon Advantage. We also provide them with comprehensive vision, a blood pressure monitor for members diagnosed with hypertension. Blood pressure monitors are normally covered by Medicare. For our members, usually they're covered under the Medicaid benefit. However, they have to go through a DME vendor, which can be a little bit cumbersome. And so we've been offering members diagnosed with hypertension a way for them to order it through an OTC vendor. We also provide urgent virtual care with doctors at Teladoc, a 24-hour nurse advice line. If a member is discharged from the hospital or a SNF stay, they get meals delivered to them. They can get up to 56 meals after each discharge. Each of our members also have access to a gym benefit under Silver and Fit. They have access to thousands of gyms across the nation. They also can access health coaches, and if they can't go to the gym, they can order fit kits to be sent home to them. They also have, we contract with Signify Health to provide in-home wellness visits to be able to do the annual wellness visits that's offered by Medicare. And then for 2023, a new exciting benefit is in-home social supports through Papa Pals. That's 90 hours per year, and these pals that our members can set up appointments with, they'll help with cleaning, light cooking, just being a friend, playing games, transporting the member to the grocery store to buy foods or even pick up prescription drugs. And then they will even take care of your pets, play with them or walk them. And last, one of the new benefits for 2023 is that our members have access to a personal emergency response system. And so that's one device per year, and then also that goes along with the customer service with it too. And that concludes my presentation. Please, if you have any questions or comments, please put that in the chat feature.
Viet, thank you. That was fantastic. You guys know how to be thorough, I'll tell you that. A lot of great, incredible detail in a comparatively short amount of time. Friends, we're just looking at the clock here. We want to try to conclude by the top of the hour here. So we're going to have a brief section where we can go ahead and respond to some of the answers that came through our Q&A section here today. Cory and Viet, you've seen a couple of the questions that came through here. Given the shortness of time that we have, were there particular questions you wanted to make sure that we addressed here today?
Paul, I flagged a couple that I think we could answer pretty quickly. I know my topic ran a little long, so I know we're squeezed on time. Looks like we have a lot of questions, but I picked up a couple that I think we could answer pretty quickly. So I might just kind of dive into that. I thought I might show, one of the questions was about making sure that we knew how to find the criteria for a PA for a specific med. So I thought I would just screen share real quick, and I've got both Medicare and Medicaid available. Well, if I could move this bar out of the way there. So on our website, we do have CareOregon and CareOregon Advantage. So two different websites. They both operate pretty similarly in terms of functionality. So when you get there, right now I'm on the general CareOregon one, so a little bit more Medicaid centric. And if you follow to providers, to pharmacy resources. Under the policies, this is where our pharmacy policies and our PA use criteria is. And I described this a little earlier where there's kind of a dynamic search. So here I'm searching Humira and it pulls up our TNF inhibitor criteria and then the specific document. That's a big one. As I said, a lot of indications for the biologics. Medicare has a similar, so again, that's CareOregon Advantage .org, and I'm under the members section here. And a lot like the Medicaid, you've got the formularies and then also PA criteria. Viet, I don't know if there's anything you want to speak to regarding the posting of the CareOregon Advantage criteria.
Maybe just a few comments. As you can see, the criteria for Medicaid and Medicare is very different. Medicaid is structured more like a decision tree, but the criteria that is posted on the website is very, it's how CMS instructs Part D plans to submit their criteria. So you don't really see the indications that it's approved for. Generally, it's all FDA approved indications and some medically accepted indications. And then we have exclusion criteria, what's required to be submitted in medical record documentation. And then under the other criteria is where you might find the alternatives that we require before, if there are any alternatives required. Generally, for Medicare, we don't require more than 2 Part D drugs to be tried before they can get, before a member can get the drug that is being requested.
Great. Other questions that you thought we should try to field, given the shortness of time that we have remaining, friends?
Yeah, I've got another one here, so just a couple we can knock off quickly. There was a question to clarify on the turnaround time hours. Those regulations, the 24 and 72, are true hours. Those are not business hours. So I don't know if you call them calendar hours, but that's what we have to respond to. There's
like
also
hours in real time, right?
Real
like
time.
Real time hours. Yeah. Okay.
Real time. We also received a question about how often the formulary and PA criteria are updated. Maybe I can speak quickly to kind of our post P&T process, and then Viet, you probably have some Medicare specific you might want to throw in there. But our P&T committee meets every 2 months. So typically our formulary and PA criteria are getting updated kind of on that 2-month cycle. So for example, we just met in November. So December 1st is when the formulary and PA criteria were updated, and kind of every couple of months thereafter. And then Viet, I don't know if you want to speak to the Medicare maintenance.
So in addition to the P&T changes that are made every 2 months, our Medicare formulary and PA criteria is updated on a monthly basis. And so that could be just new generics that come on that we add, or brands that we are removing because of generic approval to the market. And then we also have a running list of drug changes that we provide monthly that we've made year-round.
And I've put up on the screen, at least this is from the Medicaid, we do try to post a formulary change. So we not only post the formulary document in kind of its entirety, but also try to do at least kind of a change from the most recent P&T, and talks about, so for example, on here in November, we did just expand to include some non-diabetic DME, so some needles and syringes that would be used typically for like hormone injections. So that's an example of one that was added, and with that information about how it was added from a quantity limit perspective. The other question I saw early that I think I can answer, but Viet, I'll defer it to you. I mentioned for Medicaid some of the challenges that members might face with MAP ID rejections for pharmacies away from Oregon. Could you comment on the Medicare members and what their experience? Would they have a similar barrier, or are they able to travel a little bit more freely?
Our Medicare members, they can travel pretty freely in the United States. They're not restricted by the MPI requirement that's in place for Medicaid.
Excellent. Well, I'm just looking at the time, friends, and You have all been incredibly generous with your time here this morning, Viet and Cory and Renee. Wow, we're very fortunate to be able to get a hold of you for this amount of time, given how incredibly busy you all are. So we feel really, really thrilled for the opportunity here. Let's all of our attendees give our presenters a big hand, and we'll go ahead and wrap things up today.